You're doing everything right. You're taking your B12 supplement every single morning, just like the bottle says. You've been doing it for months, maybe even years, and yet you're still tired. You're still getting brain fog. You're still walking into a room and completely forgetting why you went there. Your doctor checks your blood levels, looks at the numbers, and says everything looks fine. But something feels deeply off. And here's the thing nobody tells you. The problem might not be that you're not taking enough B12. The problem might be that your body after 60 has quietly lost its ability to actually use the B12 you're giving it. And that changes everything about how you need to approach this. Stay with me, because what I'm about to share with you in this video could genuinely change the way you think about your energy, your memory, and your long-term health. And if you've been frustrated with supplements that just don't seem to work the way they used to, this one is going to hit home. Before we go any further, if you're new here, welcome. This is Dr. Alex Morgan, Aging Wellness Lab, and everything we do here is focused on helping people over 60 understand their bodies better, make smarter decisions about their health, and actually feel good, not just look okay on paper. If that sounds like something you need in your life, hit that subscribe button right now and tap the bell so you never miss a video. And if you already know someone who's been complaining about being tired all the time despite taking vitamins, share this with them. It could be exactly what they've been looking for. Now, let me start with a story. I had a patient, I'll call her Margaret, not her real name. She was 67 years old, sharp as a tack her whole life, a retired school teacher. And over about 2 years, she started to notice things. She was exhausted by noon. She'd forget words mid-sentence. Her legs felt heavy. She had this odd tingling sensation in her feet that came and went. She went to 3 different doctors. They all ran blood tests. They all said her B12 levels looked normal. One doctor told her it was just aging. Another told her to sleep more. But Margaret knew her body, and she knew something was wrong. When she finally came to see me, we didn't just look at her standard B12 serum levels. We dug deeper, and what we found changed her life completely. She wasn't deficient in B12 because she wasn't consuming it. She was deficient because her body had completely lost the ability to absorb and process it. And this right here is the conversation that the healthcare system is not having loudly enough with people over 60. So let's actually talk about what B12 is, why it matters so much, and why the way your body handles it changes so dramatically as you get older. Vitamin B12 is one of the most critical nutrients your body needs. It plays a central role in how your nerve cells function, how your red blood cells form, and how your DNA replicates. Without enough functional B12, your nervous system starts to break down slowly. Your cognitive function declines, your energy production suffers, and the scary part is, it happens gradually. It sneaks up on you. You don't wake up one day and feel like a completely different person. You just slowly start feeling like a slightly worse version of yourself week after week, month after month, until one day you realize you haven't felt truly alive in years. And here's what I want you to understand deeply. B12 deficiency is not just about feeling tired. When B12 is functionally low in your body for an extended period, the consequences become very serious. We're talking about irreversible nerve damage if left untreated. We're talking about increased risk of dementia. We're talking about higher homocysteine levels in your blood, which is a major independent risk factor for stroke and heart disease. A large-scale study that followed adults over 60 found that those with low B12 levels had brain volume loss at twice the rate of those with sufficient levels. Let that sink in. Your brain was literally shrinking faster, not because of some unavoidable genetic fate, but potentially because of something as addressable as a nutrient deficiency. That is both terrifying and incredibly hopeful because it means it's fixable, but only if you understand what's actually going wrong. So what does go wrong? Why does B12 absorption change so dramatically after 60? The answer starts in your stomach. Now, I know talking about stomach acid isn't the most glamorous topic in the world, but bear with me, because this is where the story gets really interesting. When you're young and healthy, your stomach produces something called hydrochloric acid in significant amounts. This acid does a lot of jobs, but one of its most important roles is to help release B12 from the food you eat. Because B12 in food, whether it's from meat, fish, eggs, or dairy, isn't free-floating. It's tightly bound to proteins. Your stomach acid breaks apart that bond and sets the B12 free so it can begin the absorption process. But here's what happens as you age. After about 50 to 60 years old, a large percentage of people, some studies put the number as high as 30 to 40%, begin to develop a condition called atrophic gastritis. It's a chronic, low-grade inflammation of the stomach lining that gradually reduces the stomach's ability to produce acid. Less acid means less protein digestion. Less protein digestion means the B12 stays trapped. It never gets released. It travels right through your digestive system and exits the body without ever being absorbed. You could be eating a perfectly B12-rich diet and still becoming deficient. And here's the kicker. This often happens with zero obvious symptoms. You don't feel your stomach acid declining. You don't get a warning signal. It just quietly happens. But the stomach acid problem is only the beginning. There's a second layer to this story that's even more fascinating and even less talked about. Once B12 is freed from food by stomach acid, it needs a special escort protein to actually get absorbed into your body. This protein is called intrinsic factor. It's produced by specialized cells in your stomach lining called parietal cells. Intrinsic factor grabs onto the freed B12, forms a complex with it, and then carries it down to the last part of your small intestine, the ileum, where it gets absorbed into your bloodstream. Without intrinsic factor, B12 simply cannot be absorbed through normal digestion. Period. And here is the sobering reality. As we age, those parietal cells in the stomach can become damaged or reduced in number. Atrophic gastritis specifically attacks them. Autoimmune conditions, which become more common with age, can also cause the immune system to attack parietal cells directly or destroy intrinsic factor itself. When this happens completely, it leads to a condition called pernicious anemia, which used to be a death sentence before B12 injections were discovered. But even when it happens partially, which is far more common and far less diagnosed, it creates what I call functional B12 deficiency. Your blood tests might look borderline normal while your tissues are actually starving. Now let's add another layer to this, because I want you to fully understand why this is so complex and why a one-size-fits-all answer doesn't work. There is a very common class of medications called proton pump inhibitors. You might know them by names like Prilosec, Nexium, or Prevacid. These are some of the most prescribed drugs in America, particularly among older adults. They work by dramatically reducing the amount of acid your stomach produces because they're designed to treat acid reflux and GERD. And they do work for that purpose. But here's the trade-off that doesn't get enough airtime. By reducing stomach acid, these drugs can significantly impair your ability to release and absorb B12 from food. Studies have shown that long-term use of proton pump inhibitors is associated with a meaningful increase in B12 deficiency risk. And it's not a small fringe finding. The FDA actually requires a warning about this on these medications. Yet in clinical practice, how many patients on long-term acid blockers are being regularly screened for B12 status? Not enough. Not nearly enough. And if you're on one of these medications right now, I'm not telling you to stop taking it. Please don't do that without talking to your doctor. But this is absolutely a conversation worth having. Metformin is another medication worth mentioning here, and this one is particularly relevant for the millions of Americans over 60 who are managing type 2 diabetes. Metformin is an excellent, well-established drug for blood sugar control. But research has consistently shown that it can interfere with B12 absorption by affecting the calcium-dependent mechanisms in the ileum that help the intrinsic factor B12 complex get absorbed. Some studies suggest that up to 30% of people on long-term metformin develop some degree of B12 deficiency. If you're taking metformin and you're experiencing fatigue, cognitive issues, or nerve-related symptoms, tingling, numbness, weakness, this is a conversation your doctor absolutely needs to know you want to have. Now, I want to shift gears a little bit because I've been talking about why absorption fails, but I also want to talk about something that happens after absorption, something that most people don't know about at all. Even if B12 gets into your bloodstream, it's not automatically useful to your cells. Your body needs to convert it into its active forms to actually put it to work. There are two main active forms of B12 that your cells can use. One is called methylcobalamin, and it's critical for brain function, nerve health, and the methylation cycle, which is a fundamental biochemical process involved in gene expression, detoxification, and the production of neurotransmitters like serotonin and dopamine. The other active form is called adenosylcobalamin, and this one lives primarily in your mitochondria, the energy-producing powerhouses inside every cell. It's essential for converting certain fats and proteins into fuel. When this process is impaired, you feel it as deep, persistent fatigue. Not the kind that goes away with sleep. The kind that makes you feel like you're running on an engine that's only firing on 2 cylinders. Now here's where it gets particularly interesting, and this is something I find genuinely compelling from a research standpoint. A significant percentage of the population has genetic variations in an enzyme called MTHFR, methylene tetrahydroffolate reductase. That's a mouthful, so just remember the letters, MTHFR. This enzyme is involved in the methylation cycle and in the conversion of certain B vitamins into their usable forms. People with certain MTHFR variants have reduced efficiency in this conversion process. For these individuals, taking the most common synthetic form of B12, called cyanocobalamin, which is what you'll find in the vast majority of cheap supplements and fortified foods, may not be nearly as effective. Their bodies struggle to convert it into the active forms they need. And the estimate on how many Americans have at least one copy of a significant MTHFR variant? Somewhere between 40 and 60%, so it's not a rare edge case, it's potentially the majority. And yet, how many supplement labels do you see talking about this? How many doctors are screening for MTHFR before recommending a standard B12 supplement? Very few. So when you put all of this together, the reduced stomach acid that comes with age, the declining intrinsic factor production, the common medications that interfere with absorption, and the genetic variations that affect conversion, you start to understand why so many people over 60 are functionally B12 deficient despite what their standard blood test says. And you start to understand why just buying another bottle of the same kind of supplement and taking the same dose is not necessarily going to solve the problem. Let's talk about testing for a moment, because this is where I see a lot of confusion. When your doctor orders a standard B12 blood test, they're measuring total serum B12. This is the amount of B12 circulating in your bloodstream. And here's the problem. This number can look perfectly normal while your cells are actually deficient. Why? Because a large portion of the B12 in your blood is bound to proteins called haptocorins, and it may be biologically inactive, meaning your cells can't actually use it. The fraction of B12 that your cells can actually access and use is called holotranscobalamin, and it makes up only about 20 to 30% of your total serum B12. Some practitioners call it active B12, and measuring it gives you a much more accurate picture of whether your tissues actually have what they need. There are also two functional markers, methylmalonic acid and homocysteine, that rise in the blood when your cells don't have enough functional B12 to do their jobs properly. Elevated methylmalonic acid in particular is considered one of the most sensitive early indicators of cellular B12 deficiency, and it can be detected through a simple blood or urine test. If you've been told your B12 is fine based on a standard serum test, but you're still experiencing symptoms, ask your doctor specifically about testing holotranscobalamin and methylmalonic acid. These two additional markers could tell a completely different story. Now, I want to take a moment to talk about symptoms, because I think many people dismiss or misattribute things that are actually signs their body is crying out for B12. Fatigue and weakness are the most common complaints, but they're also so general that people chalk them up to just getting older. The cognitive symptoms, difficulty concentrating, memory lapses, slower word retrieval, mental fog, these often get dismissed as early dementia or just normal aging, when in fact they may be a reversible B12 issue. Neurological symptoms are the ones that concern me most when I see them in patients, because these indicate that nerve damage has begun, tingling or numbness in the hands and feet, a burning sensation in the tongue, balance problems and difficulty walking in a straight line, muscle weakness that isn't explained by orthopedic issues, mood changes, particularly irritability, depression, and anxiety that seem to have come out of nowhere, vision disturbances, though these are less common, and perhaps most alarming, a condition called subacute combined degeneration of the spinal cord, which can occur when B12 deficiency goes untreated for too long and begins to damage the protective myelin sheath around the spinal cord. The reason this matters so much is that some of these neurological effects, if caught early, are fully reversible with proper B12 treatment. But if left untreated, some nerve damage can become permanent. This is not meant to scare you. It's meant to motivate you to take this seriously and to advocate for yourself with your healthcare provider. All right, so by now you understand the problem in depth. Let's talk about solutions, real, practical, evidence-informed approaches that take everything we've discussed into account. The first thing to understand is that if your B12 deficiency is related to absorption problems, reduced stomach acid, reduced intrinsic factor, medications interfering with gut absorption, then simply eating more B12-rich foods or taking standard oral supplements that rely on the same absorption pathway is not going to solve your problem. You need to bypass the digestive system entirely. The most reliable way to do this is through B12 injections. Intramuscular injections of B12 deliver the nutrient directly into your bloodstream without requiring any stomach acid, intrinsic factor, or intestinal absorption. For people with pernicious anemia or significant intrinsic factor deficiency, this is often the only truly effective option. Injections are typically administered in a clinical setting, though some people learn to self-administer them at home. They can be given weekly initially and then tapered to monthly maintenance doses, depending on the individual situation. Sublingual B12 is another option that many people find helpful and far more convenient than injections. Sublingual means under the tongue. When you dissolve a B12 tablet or liquid under your tongue for a minute or two before swallowing, a portion of it gets absorbed directly through the mucous membranes in your mouth into the bloodstream, bypassing the digestive system. Studies have shown that sublingual B12 can achieve blood level increases comparable to injections in many people, though the evidence varies. If injections feel too invasive or aren't practical for you, sublingual B12 is absolutely worth discussing with your doctor as an alternative. Nasal sprays are another bypass delivery method that some people use, particularly those who have had gastric surgeries or who have severe absorption issues. Now, what form of B12 should you be taking? This is where the genetic piece I mentioned earlier becomes relevant. If you know you have an MTHFR variant, or if you've tried cyanocobalamin without success, it makes sense to try the active forms directly. Methylcobalamin and adenosylcobalamin are the two active forms that your body can use immediately without needing to convert them first. You'll find supplements labeled as methylcobalamin or hydroxycobalamin. The latter is a naturally occurring form that the body can convert more efficiently than cyanocobalamin. Hydroxycobalamin is actually the form used most commonly in injections in many European countries because it stays active in the body longer than cyanocobalamin. When you're shopping for B12, look past the marketing and check the form. And while you're at it, understand that higher doses in oral supplements are sometimes used to compensate for poor absorption. A very small percentage of B12 can be absorbed passively through the intestinal lining even without intrinsic factor, and high oral doses exploit this pathway. Some doctors recommend daily oral doses of 1,000 to 2,000 micrograms for people with mild to moderate absorption problems, specifically to leverage this passive absorption mechanism. I also want to mention something about the relationship between B12 and other nutrients because they don't work in isolation. Folate, vitamin B9, works in very close partnership with B12 in the methylation cycle. Deficiency in one can mask or mimic deficiency in the other, and supplementing one without addressing the other can sometimes cause problems. This is why it's worth looking at your overall B vitamin status rather than just B12 in isolation. Similarly, vitamin B6 plays a supporting role in this same biochemical network, and zinc is necessary for the proper function of many of the enzymes involved in these pathways. A comprehensive nutritional evaluation that looks at the full picture is always more valuable than tunnel vision on a single nutrient. One more thing I want to address before we wrap up this section, and it's something I feel strongly about as someone who works with older adults: the emotional and psychological dimension of this issue. When people experience cognitive symptoms, memory lapses, and persistent fatigue, and they're told by their doctors that their tests look fine, it's incredibly demoralizing. Many patients, especially older women, I'll be honest about this, are dismissed or told that anxiety or depression is causing their symptoms, when in fact a nutrient deficiency is the root cause of what may look like psychological symptoms. Anxiety, depression, and irritability are recognized neurological effects of B12 deficiency. If you or someone you love has been prescribed antidepressants for symptoms that overlap with B12 deficiency without having a thorough nutritional workup done first, I would encourage you to ask for that workup, not to replace psychiatric care if it's genuinely needed, but to make sure a treatable nutritional deficiency isn't being misclassified as a mental health condition. Let me also be transparent with you about something. The standard of care around micronutrient testing and treatment is genuinely uneven. Some primary care physicians are very aware of the limitations of standard B12 testing and the complexity of absorption in older adults. Others, through no fault of their own, given how they were trained and the time constraints they operate under, may not be up to speed on the latest evidence. Advocating for yourself doesn't mean being confrontational with your doctor. It means being informed. It means going in and saying, I've been reading about functional B12 deficiency, and I'd like to test holotranscobalamin and methylmalonic acid in addition to standard serum B12. I'm on this medication, and I'd like to understand whether it could be affecting my B12 absorption. I have these symptoms, and I'd like us to explore nutritional causes before assuming it's just aging. That kind of informed, collaborative conversation is something any good doctor should welcome. Now, let me give you a practical summary of action steps, things you can genuinely take away from this video and apply right now. First, if you are over 60 and experiencing fatigue, brain fog, tingling in your extremities, balance issues, or mood changes that are unexplained, B12 status should absolutely be on your radar. Don't assume your doctor has fully evaluated it based on a standard serum test. Request the additional markers, holotranscobalamin and methylmalonic acid. Second, review your medications. If you're on proton pump inhibitors, H2 blockers, or Metformin, discuss with your doctor whether your B12 status is being adequately monitored and whether any supplementation adjustments are warranted. Third, look at the form of B12 you're taking. If you've been on standard cyanocobalamin supplements for a while without noticing improvement in symptoms, consider switching to methylcobalamin or hydroxycobalamin, ideally in sublingual form. Fourth, consider whether injectable B12 might be appropriate for you if you have significant absorption challenges. This is something to work through with your healthcare provider, but it's a legitimate and often very effective option. Fifth, don't look at B12 in isolation. Have a broader nutritional conversation with your doctor or a functional medicine practitioner about folate, B6, zinc, and the overall health of your methylation pathways. I want to close with something hopeful because I don't want you to leave this video feeling defeated. The story of Margaret that I started with, the retired school teacher who spent 2 years being told she was fine while she slowly declined, has a great ending. Once we identified her functional B12 deficiency, addressed her atrophic gastritis, switched her to hydroxycobalamin injections, and optimized her folate levels, her transformation over about 4 to 6 months was remarkable. The brain fog cleared. Her energy came back. The tingling in her feet resolved. She told me she felt like herself again for the first time in years, and she wasn't alone. I've seen this story play out many times. That's what makes this work so meaningful, because these aren't just numbers on a lab report. These are people's quality of life, their ability to remember their grandchildren's names, their ability to walk without fear of falling, their ability to feel joy and clarity and energy. And so much of it can be restored when you get the right information, ask the right questions, and take the right action. If this video helped you see something in a new light, or if you recognize something in what I described that might be happening to you or someone you care about, I want to hear from you. Drop a comment below. Tell me your experience. Tell me what symptoms you've been dealing with. Tell me if you've been frustrated by being told your levels are normal while you feel anything but. Your comment might also help someone else reading through this thread realize they're not alone. And if you know someone over 60 who's been brushing off their fatigue or memory issues as just getting older, please share this video with them. It could be the thing that finally gives them the words to have a different conversation with their doctor. That share button is one of the most powerful ways you can help someone without spending a single dollar. And if you haven't subscribed to Dr. Alex Morgan, Aging Wellness Lab yet, now is the time. We cover topics like this every week, evidence-based, deeply researched, and always focused on what actually matters for living well as you age. Thank you so much for watching all the way through. Take care of yourself, take care of the people you love, and I'll see you in the next one.